For the Scribe tool, we've got the Scribe app open on the right-hand side with our EMR open on the left, so we can see how it's going to update in real time from the transcription over to the documentation within the chart. Today we're going to be working with Anna Shepard, so I can see some light details on the tracking board here with some date of birth, exam number that she's in. And as I enter into the chart, I'll be asked to record or consent to record. So Anna, I'll be your medical assistant today. I do have a device to assist with note taking. Would you be okay with having that on and consent to listening to our conversation? It'll just record the notes for us.
Yes, that sounds helpful.
Okay, sure is. So let me say yes here. I'm going to press to record, and let's start off just with some quick vitals. I am going to use the thermometer in your right ear. Your temperature is 101 degrees. I'm going to take your blood pressure using your right arm. All right, your BP is 118/80. Your pulse is 68. Your O2 stat is 97, and your breaths per minute are 18. What is it that brings you into CS today?
I have pain in my left ear and a fever.
Okay, so with that, I'm just going to choose that it is her left ear today. And when did those symptoms start for you?
About 3 days ago.
Okay, how would you describe the ear pain?
It feels like a throbbing or an aching pain.
Okay, any current allergies that you have?
Nope.
Okay, any medications that you're taking or any other chronic problems?
Nope.
Okay, well, I'll go ahead and make sure this is all documented for the provider. Your fever is pretty high today, so I'll swab you for flu and COVID per our respiratory illness protocol. Those are rapid, so the results should be in shortly, and the doctor will be in soon and can go over those results with you.
Okay, great. Thanks.
All right, so we'll create note, and at this point, as the screen is flashing gray, it's going to be our indication that the tool is listening to the recording and will transcribe the conversation and put things into the appropriate sections of the chart, including our vitals, our HPI, the review of systems, and starting off indicating our diagnostic tests under the medical decision-making notes. So we can see that all of this kind of came in pretty accurately, some quotations around how the patient was describing the pain. So if I'm good with this, I can add to the patient chart. And then if we keep our eye over on the left-hand side of our screen, Anna Shepard, we can now see her vitals have updated that tracking board. So we'll go in to see the chart a little bit more once we go in as the provider. Now, once the provider enters into the room, they will see on the light tracking board that there's now a note for Anna. When they go in, they'll be able to see what has been transcribed so far with the MA, and then they can simply press to record. Because the consent has already been taken from the patient, we don't need to capture that again. We'll just go ahead and start our conversation with the patient. All right, hi Anna, I'm Dr. Zanini. I understand you're having some ear pain and a fever. Tell me a little bit more about how you've been feeling.
Good morning, Dr. Zanini. My ear's really hurting today. I was sick with a cold about 2 weeks ago, and I thought I was doing better, but now this ear pain started up a few days ago, and I can't even sleep at night. The fever started this morning.
All right, I'm really sorry to hear that. Have you noticed any drainage from your ears?
No, but they do feel like they're plugged up and full of something. Everything just sounds a little muffled.
Okay, and since getting over that cold, do you still have any cough, congestion, runny nose, sore throat?
No, none of that.
Okay, any frequent ear infections that you get?
No, I actually haven't had one of these since I was a child. It's terrible.
All right. Well, it does look like those swabs are back. The flu swab is negative. The COVID swab is also negative. I see that you do still have a fever here in the clinic. Is it okay if we go through an exam now?
Yeah, that sounds good.
All right. Your heart is regular rhythm and rate. Your lungs are clear without any wheezing or crackles. Your left eardrum is really red, dull, and bulging. Thankfully, there's no perforation in the eardrum, no drainage either. Your right eardrum is slightly pink with a good light reflex, no perforation, no drainage. The back of your throat looks normal too. It's not red, the tonsils aren't swollen, and there's no postnasal drip. And the lymph nodes in your neck are normal too. Have you taken any medication today to help with the fever or the ear pain?
No, I wasn't really sure what to do, so I just came here.
Okay. Any antibiotics that you've been prescribed in the last month from any other provider?
Nope.
Okay. Well, based off of your history, your symptoms, and the exam, you do definitely have a left ear infection. This can happen a few weeks after an upper respiratory infection, which is likely the cause of the infection today. I'm glad that you came in because the eardrum is quite inflamed and bulging. So we can treat you today and hopefully prevent any further progression, such as a ruptured eardrum. I mentioned earlier that the flu and COVID swabs were negative, so we'll only be treating you with an antibiotic for the ear infection. I show here that you don't have any allergies to medication, so we can safely prescribe you with amoxicillin. You'll be taking 875 milligrams twice daily for 10 days. Just make sure to take that whole 10 days to fully treat the infection, but you can also alternate with acetaminophen and ibuprofen for the pain.
Okay, thanks. How long before I start to feel better?
You should definitely start to feel better in the next day or two. If you're not feeling better, your symptoms change or worsen, just make sure to connect with us at the office right away.
Okay, and is there anything else I should be doing? Is it contagious? I'm a teacher, so I don't really want to get my students sick if I can help it.
No, thankfully ear infections aren't contagious, but we do definitely recommend to stay home until you're fever-free for 24 hours, as for most illnesses. Best thing that you can do really is to give your body some time to rest and heal. Drink plenty of water, take those antibiotics as prescribed so we can get you feeling better. But of course, if you have any other questions, don't hesitate to reach out.
Okay, thank you. I really appreciate it.
Of course. All right, so at this point, we'll create the note as the provider, and it'll pull in, of course, what had been documented by the MA, but also build to the note based off of what the provider had done, including our physical exam and our diagnosis and plan. We'll see in just a moment how that's all going to update within the EMR itself. So it really should reduce some of the clicks that you're doing from a documentation point of view. All right, so at this point, we can see our HPI has built. The ROS is also pulling in our physical exam with our different sections between cardiovascular, respiratory, lymph nodes, and then our diagnosis is pulling in. So it is pulling in with the otitis media with the appropriate code. And at this point, as the provider, I can now choose what the risk is, if it's continued illness, likely, unlikely, if it poses a threat to bodily function, and that will help to drive the E&M level that's going to be generated within the EMR. We can also see the full plan for the 875 milligrams of amoxicillin and to rest and hydrate. So at this point, everything looks good. If there was any sections that we did want to change or update, this is a text box, so I can easily come in here, delete, or type in anything new. But everything looks good to me, so I'm going to add that to the patient chart. We can now see our green banner that the encounter was saved successfully. And if we move over now into the EMR, I'm going to open up Anna's chart. At this point, we'll see most of that information is going to translate right over into documentation. And we can see our notes populating in, and we can see that it mirrors what's over in our HPI within the Scribe tool. The chief complaint you can see is populating in. The main problem is documenting as structured data, including the notes. So we can see that the notes here is mirroring what's over in the HPI within our Scribe tool. And then the ROS and our exam are marking as completed, indicating that those have been done based off the fact that the ROS and physical exam is documented here within our Scribe tool. Now, most of the information right now is going to come into our transcription tool where we can see the ROS, the exam, and the plan. That, as time goes on, will pull in as structured data within the ROS, past family social history, and exam section. But we can see in the A&P that the diagnosis and the code is populating in. our plan and the 10-day course of amoxicillin is showing up here as well. That way, all that I really need to do now is actually go through the prescribing process to fully prescribe the 875 milligrams of amoxicillin. So really by the end of 2026, our goal is for about 80% of documentation to be done directly from the Scribe tool, with future goals for everything to be done, including discharging the patient, all from the Scribe without even opening the EMR.